Good afternoon, my friend. Today's conversation on Weekend Connection has to do with home health care, the various types of home health care, and some issues to consider regarding home health care. There's a lot to think about, and Crystal Wilkinson is going to help us navigate through some of those issues today on Weekend Connection. Let's get connected. Good afternoon. Welcome to Weekend Connection on the Bible Broadcasting Network. My name is Ed Phillips, and I have as my guest today really a longtime friend. My wife Grace and I have known her for a long time, dating back to our days in Arizona. Her name is Crystal Wilkinson, and she lives in Sun City, Arizona. Boy, that sounds like a great place to live. Hi, Crystal.
Hi, Ed. How are you?
I am doing well, and yourself?
I'm great. Thank you for asking.
It is good to have you on Weekend Connection, and I asked you to come on because we're going to be talking together about topics related to, working with senior citizens, but particularly healthcare, and there's just a wide range of topics that we are going to get into. But first, Crystal, a little bit about yourself. Tell our BBN listeners what you're doing presently and how you moved into the home health care field and what you were doing before.
As Ed mentioned, Ed and I knew each other back when I was the long-term missions coordinator at Casas Church down in Tucson, Arizona. My duties there consisted of just being the home connect with missionaries all over the world, and I was their support system, allowing them to have that connection back to Tucson and allowing them to come home on furloughs, helping them set up different kinds of housing and support system that way, and just administratively helping the pastor that was overseeing the missions at our church. In 2009, my husband was diagnosed with cancer, and I became the family caregiver. Very quickly learned quite a bit about home care and healthcare in general and cancer, and slowly realized that I could no longer be as what I called super mom, getting the kids to soccer practice and different events and things, as well as taking my husband to his daily infusions. And so at one point, I had to make the very difficult decision to bring in home care to help so that to keep my husband safe in the home. And so that was my first introduction to home care. And through the process of this, my husband and I talked about the bucket list. You know, what were some of the things that he had always wanted to do in his time, and one of the things was to be a business owner, and we slowly got to know a little bit more about home care. I met the founder of the company that I now own, Adult Care Assistance. She was also a cancer survivor, but unfortunately had been re-diagnosed and was looking for somebody to take over her business. And she and I met one day, kind of halfway between our houses, met at a coffee shop. And the words that she said to me very first kind of resonated. She stopped me in my tracks when we first walked into the restaurant to meet. And she said, "Before you sit down, I need to know, are you going to put God first, your family second, and this business third?" And I said, "Absolutely." And she said, "Sit down, let's talk." And I was very impressed with the way that she ran her business with God being first. And so slowly I started the process of purchasing her business. She retired and was able to travel with her family and enjoy her retirement. And she passed away about 2 years after I purchased the business from her. But she and I had become very close friends, and I miss her to this day, but at least I know where she's at.
Now, Crystal, what type of cancer did your husband contract?
He actually had it had been pardon me, it had metastasized in the testicular, but it was a very fast moving cancer. That was just where we had found it. By the time from diagnosis, which was just the day before Thanksgiving, to surgery, it had grown from the size of a pea to the size of a golf ball. By December 26th, when he had his first full body scan before we started chemo, it had actually moved into his liver, kidney, and spine. And so it was a very aggressive form of cancer. So fortunately, he responded very well to the chemo treatments and is doing very well today. He is no longer seeking treatments and is back to being, active and things. But I did watch him go from being an active runner and mountain biker to somebody who could not transfer safely out of bed on his own. Difficult thing to watch, for sure.
Well, praise the Lord, he's doing so well, and God really used that time in transitioning you from being a missions administrator to being a business owner. As you said, purchasing this business. I can well imagine you got on a very steep learning curve, didn't you?
Very quickly, yes. I was just going to say it's not something that you wish on your worst enemy, but it's amazing how God will take you through the trials and through the fire, and to sometimes show you exactly what He wanted you to become. And I don't know that I would ever say that doing home care or senior care would have been straight out of high school what I had would have been my dream or aspirations, but I definitely am thankful for every moment and for our experience of going through this, because it has affected every single one of my family members in a positive way.
What are some of those lessons you learned early on from purchasing the business? And then I want to talk about some of the issues that we need to talk about together for our listeners regarding about being proactive in care of elderly care issues and so forth.
Well, as far as purchasing the business, I guess I learned early on that I really had no idea what I was doing. But I also found that that God will provide you with every single tool that you need to be successful if you're following His will. I did not have a background in senior care, and I didn't have a whole lot of knowledge about what I was doing. I learned about home care from being the family caregiver, but I was placed in a position where I have really amazing staff members who knew their job and were willing to teach me and train me as the new owner, and as well as friends and family members who were able to step up alongside me and encourage me along and tell me you can do it when I needed those moments. Probably the biggest thing coming from our personal experience, the two things that I would come out of it is we were a very private family. I'm a very independent person, and so the hardest part for me was asking for help. Probably hands down the most difficult decision I've ever had to make in my entire life was making the decision to bring a perfect stranger into the home to care for my husband. When I was the spouse, I loved him. That was the vow I made to him, was to care for him in sickness and in health, and to realize that I couldn't do it all by myself and allow the help that I needed to come in was the most difficult thing that I had ever done. But because I allowed the help to come in, I know for a fact that my husband's still with me today. So probably one piece of advice would be, don't be too proud and allow others to step up alongside you and help you when you need help. Also maybe that long-term care insurance would have been super helpful had we thought ahead. My husband was 38 years old at diagnosis, so you don't really think about needing it. He was young and healthy, and suddenly, we have a lot of medical bills. Thank goodness we had some savings, but even with our insurance, it financially was difficult to cover everything. And so that was maybe one other thing that I looking back, what would we have done different? Maybe we would have gone ahead and, invested in one of those policies. That would have been a good thing to do.
Hindsight is 2020, right? It's a known fact that longevity has increased among both males and females. Now the figure is well into the 80s. I think probably for males it's early to mid 80s, and females a few years longer than that. And so, like you said, when we're in the, quote, prime of our lives, we're very busy and we don't often think about some of these issues as we get older, especially regarding whether it's our spouse or parents. And what are some of those things that people can think about proactively and act on? You mentioned one thing about possibly getting some long care insurance. What are some other things?
Probably some of the big triggers that I see are when people are starting to need to ask for more help. So often it's, when I'm speaking to groups, it's not necessarily the person I'm speaking to that's the one that actually needs the help right now. But it may be that they are suddenly a friend or a neighbor who has found themselves in a position where they're helping a friend or a neighbor. And so when you start looking at, depending on your friends, your neighbors, your family members, things like that, to be able to do things like help you get to the grocery store, or you're afraid of falling when you're in the bathroom, or just you're afraid to be alone during bath time because you don't know what's going to happen. Those type of things are all triggers that maybe it's time to start having a conversation. It may not mean that you need 24-hour care at the moment, but it might be time to be starting to just have some conversation about what would make my life easier. Especially for ladies, sometimes it's difficult to make meals. Standing in the kitchen for long periods of time, or even possibly lifting the plate up into the microwave above their waist level, can be difficult. And so they find themselves not eating, or maybe they're not eating as much because there's no company around. They're alone. And so they're just not as interested in that. So those are all different things that would be triggers to say, maybe it's time to have that conversation. Like I said, it doesn't need to necessarily mean that you need 24-hour care. It might just mean that you need somebody to be there first thing in the morning when you're not quite as stable on your feet as you're first waking up, to help you get dressed, get a shower, maybe help prepare breakfast, just kind of get the day going, and then you're fine throughout the rest of the day. You can end up having a friend come in and just help you with that. But if it gets to be where it's on a regular basis, it might be time to be starting to look at home care or another option. Might even be at some point a good idea to even begin looking at assisted livings. There's a lot of places that you can start out where it's like independent, but you're already in the community, but that community will allow you to change and move through their programs as needs occur. So it might be that you're in the independent, but if you do have some kind of maybe you get pneumonia or you have a fall, they would have an assisted living section all the way up to memory care or skilled nursing in case something else happens, all right there in that same community. A lot of times those communities are good for somebody who is maybe spending a lot of time alone. They have a lot of great activities, social activities, things like that can also be very beneficial as well.
So regarding the home health care, there's different levels of home health care. And what are some of those? You mentioned somebody coming in, for example, in the mornings. And are there other levels as well?
With home care, there's actually two different types of home care, and it can be very confusing for even our medical doctors and hospitals and things. So we have what is considered, and I really don't like the term, non-medical home care, which focuses just on the personal care needs. Non-medical in-home care is going to be the caregivers who can come in, and they may come in just for companionship. Maybe they can come in and provide meal preparation, light housekeeping, helping with bathing and dressing. If we have incontinent issues, maybe helping with changing of depends or toileting needs. They can also help with transportation to doctor's appointments, maybe just organize the kitchen so that things are easier to get to instead of having to climb up on a ladder for the dishes or something like that. They can, do activities, puzzles, or help, cooking meals together, doing things together, going for walks, that type of thing. So those are all the personal care needs. Then there is the medical home health, which is also home care. Typically, this comes in after a discharge from the hospital. Maybe it was a fall, maybe pneumonia, something like that, where you've gone to rehab and now you're heading home. And this is where we're wanting to have that safe discharge back into the home. And this one would have to be something that a doctor prescribes. And this is where your Medicare is going to come in and start covering the services. The medical home health is going to be overseen by a physician or a RN. They may have a CNA come in as far as the caregiver, and they can also do bathing, but they're going to mainly be looking at if there's wounds, they can do the wound care, medication management, physical therapy, occupational therapy, those type of services. And typically they're in the home for shorter durations, but they might come in the home 1 to 4 days a week. They might come in for, maybe an hour to 2 hours in duration at most, where the personal non-medical side, they can be there anywhere from a couple hours all the way up to 24 hours a day. So those are the different levels of different care. So the non-medical person can also help care for somebody who's bedridden, but they're just not going to do the medical portions of it. So if there is a wound or something, you might see both a personal care attendant coming in as well as a home health aide coming in, which would be the medical side coming in just to help with the more skilled side of the needs.
This whole field in home health care has just mushroomed over the years. You got into this field in what year again?
I purchased our business in 2012.
And would you agree that it's just absolutely mushroomed because of people's schedules and life and things like that?
Well, certainly. And we also have our baby boomers are coming of age, which means that we have a lot of the baby boomers who are now hitting the seniors. We're living longer, as you mentioned earlier. And so, it's just kind of the perfect storm. So we're seeing a lot more dementia with our patients than we did even back in 2012, as well as we're seeing people live longer. I'm caring for a little gal right now who's 106 years old, and she's absolutely amazing, as spunky as all get out. And I think she might make it to 108. I'm not sure.
I know we could go on, and there's a lot to talk about. I really appreciate you taking time out of your schedule to talk with me and to talk with our BBN listeners about home health care. And if our listeners would like more information, how can they contact you?
they can go on our website, which is www.adultcareassistance.com, and they can fill out. There's inquiry forms for more information right there on our website, as well as a lot of really great resources and information. There's a whole section of free senior services, which talks about the Alzheimer's Association and many of the other, free services that are available to seniors. And so that might be a good place for them to take a look as well.
Crystal Wilkinson, I thank you for joining me today on Weekend Connection. Thanks so much again for taking time out of your very busy schedule and enlightening me and many of our listeners on some of these very, very important issues.
Ed, it was my pleasure. Thank you for your time.
If you would like to reach out to Crystal and just get some more information about home health care, then log on to www.adultcareassistance.com. www.adultcareassistance.com. Weekend Connection is a public affairs program of the Bible Broadcasting Network.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.